welcome to our first ever mini grand rounds. We're really excited to have you here today. This event is hosted by the Annals of Family Medicine, and my name is Bettina. I'm the new Scholarly Communications Manager. We're excited to have you here. Today, we're going to be discussing a paper recently published in the Annals that looks at falling rates of vaccinations across the U.S. And we're joined today by our authors who will be giving us a quick overview of the paper itself, and perhaps more importantly, we'll be walking through some of their suggestions of what we can do to address this worrying trend. Again, we're joined today by two of the paper's authors, Eva Skolnick and Alex Bhatti. One thing we wanted to note is that the paper's authors are employed by Merck, and this is as declared in this conflict of interest statement here on the screen in front of you, as well as in the original paper as published in the Annals of Family Medicine. With that, I'm going to hand things over.
Thank you so much to the Annals of Family Medicine and to my co-authors for the opportunity to present today. I'm Eva Skolnick, and I'm going to kick us off before turning it over to my colleague, Alexandra. And so first off, I want to acknowledge all of our healthcare workers on the line today, and on behalf of all of us, say a big thank you. We know that to end the COVID-19 pandemic, individuals across the United States, from government officials to frontline workers, are engaged in a tireless effort to ensure Americans have access to and are vaccinated against COVID-19. Ending the pandemic is mission critical. However, it's also essential to build back stronger by developing and implementing measures to recover from subsequent public health consequences of the pandemic. So today, I'm going to go over the impact of COVID-19, promising practices that we have seen, and what that looks like ahead. Because right now, we have the opportunity to modernize the vaccine infrastructure to meet today's and tomorrow's health challenges. So first, let's talk about the impact of COVID-19 on routine vaccination. The health challenge in front of us today is that we have seen severe disruption to routine vaccination services, resulting in deficits in vaccine coverage rates across all age groups. 11 million doses of childhood vaccines have been missed in 2020 in the United States, and upwards of 82% declines for adolescent vaccination in some localities in the US as compared to 2019. Recovering from the deficit means addressing missed doses of individuals who are unable to be vaccinated during the pandemic, and this requires a cross-sectoral approach to increase awareness and drive action. Today, I'm going to cover how medical societies, local and state health departments, and providers have all been engaged to return to care and share some of those promising practices. However, more must be done. At the conclusion of our presentation, we'll share some short-term strategies to recover routine vaccination rates and practical, tangible strategies to strengthen the vaccine ecosystem. Declines in routine vaccination rates put our communities at risk, and we must all work together to recover and improve routine vaccination coverage rates. So first, I want to dive a little bit deeper into the data. According to the CDC, wellness visits are essential for scheduling and receiving appropriate vaccinations, and many childhood vaccinations are received during routine wellness visits. The graph in front of you right now details that as compared to the 3-year average from 2017 to 2019, all age groups have fallen behind in wellness visits. However, we have seen the greatest decline in certain age groups. I specifically want to call your attention to those that are falling the furthest behind, which is adolescents. As you can see, the purple and red line describe the impact of COVID-19 on wellness visits for adolescents, which have seen between a 17% drop for those between the ages of 13 to 17 years old, and an even larger drop in the red line of 24% for adolescents between 11 and 13 years old. These statistics are shocking. I also want to note that this data is private claims data, so it doesn't even account for our most vulnerable and underserved populations who we know are falling even further behind and are slower to recover. So we really need an all hands on deck approach to recover and improve these vaccine coverage rates. Many stakeholders across different sectors have already begun the work to recover and improve routine vaccination. To raise awareness of the declines in routine vaccination, local and state health departments, Medicaid programs, commercial health plans, medical societies, faith-based communities, community-based organizations, and many, many more have implemented many different strategies. I want to highlight just a few of them so you can think of different ways to leverage these resources in your work. And as my colleague Bettina mentioned, she will drop the links to these campaigns as I review them. So hopefully you can leverage them after the webinar. First, national organizations such as the American Academy of Pediatrics launched campaigns to remind patients and families of the importance of returning to their healthcare professionals for routine vaccinations. AAP launched the Call Your Pediatrician campaign to remind patients about returning to the office for essential health services such as vaccination. I'm going to play a snip of the video so you can see how you can leverage it with your patient population.
Getting your children caught up on all their immunizations is one of the most powerful things you can do. This is a superhero moment. Protect your kids against dangerous diseases and make sure they're ready to face the world. Normal is coming. Call your pediatrician today.
So you can see that they use the imagery of a superhero to empower patients to take control of their healthcare and make sure patients and families feel safe and supported when returning to care. The takeaway is this: making vaccination a priority and returning to care is akin to a heroic act for yourself, for your family, and your community. That's the message patients need and want to hear in order to drive awareness and take action. Similarly, states are encouraging patients and families to receive routine vaccinations through locally tailored campaigns. We've seen examples across the country, and I'm going to call out a few. First is California's Don't Wait, Vaccinate campaign. As we know, tailoring to the needs of your local population is crucial while making sure resources and campaigns are accessible to all. California made sure that their campaign was culturally and linguistically appropriate, and I'd encourage you all on the line to utilize multilingual and bilingual resources depending on your patient population. Next, Washington State utilized the back-to-school season to encourage and mobilize patients to return to the office to get caught up on vaccinations for in-person school. And lastly, the superhero message really rang true with Michigan Department of Public Health Be a Hero, Vaccinate campaign, helping kids and parents feel like a hero for their health by getting vaccinated. And lastly, meeting people where they are is critical to recovering and improving vaccination coverage rates. The national nonprofit organization Vaccinate Your Family, in collaboration with Merck, launched a program in May that includes this PSA to encourage people to get caught up on missed vaccinations.
This past year has not been easy, to say the least. So, as a family,
we've decided to skip some old rules and routines.
Like skip making my bed?
Fine.
Yes!
But Dwayne and I decided not to skip the doctor for our kids.
Doctors are doing a lot to keep their offices as safe as possible.
Thank you.
Talk to your preteen's doctor about scheduling their well visit and recommended vaccinations. Let's go.
We highlight these campaigns and hope that you can elevate them to your patient populations. While the campaigns are really helpful and necessary in the short term to encourage patients to return for care, there are additional policy and programmatic practices that can help recover and improve vaccination coverage rates. So I'll turn it over to my colleague, Alexandra, to discuss what those practices are. Alexandra, over to you.
Thank you, Ava. Good morning, good afternoon, and good evening, everyone. As Ava mentioned, the latter half of this presentation will be focused on what we can do as a community to recover vaccination rates and build back stronger. But first, I want to take a step back to underscore the realities of some of the data that Ava shared at the top. Recent projections have modeled recovery scenarios to get a sense of just how long it may take to make up for what has been missed during the pandemic. And before I divulge those results, I want to ask the clinicians on the line to think back to pre-pandemic days and recall the volume and number of patients they may have seen for vaccination services, whether that was during a wellness visit, vaccination-only visit, or other type of visit. In particular, thinking about the back-to-school period and the summer months when many young patients come in for their school and summer camp physicals or vaccinations for the next school year. And I ask you to think about this because those projections that I mentioned are estimating that it could take up to 3 to 7 years to recover what's been missed, particularly for our adolescent population. And that's assuming that each clinician sees 15% more patients every month for those 3 to 7 years. That's 15% more every 3 to 7 years. And that was shocking for me to see. And so as we think about the road to recovery with some of these statistics in mind, and from a sheer provider capacity perspective, it becomes more clear that to be successful in this effort, it will require ingenuity and thinking creatively about how we can work together to recover what's been missed. And we'll place a link to the study in the chat for you to review as well. The good news, however, is that there are best practices and evidence-based strategies that can be leveraged to support and bolster recovery and build back a more resilient vaccine ecosystem. And over the next several minutes, I'm going to touch on examples of those strategies, including what can be leveraged at the practice level. First, I'm going to focus on those strategies that can support vaccination uptake here and now. One of the principal measures being exactly what I mentioned on the previous slide, that we can't do this alone or in silos, and that coordinating across sectors will be key to maximizing our impact. This truly will require an all-hands-on-deck approach, central to it being you as clinicians, as well as the rest of our healthcare and public health community, government from the local to federal level, education community, equity community, private sector, and more. Second, as Ava mentioned, the pandemic has truly elevated the importance of meeting people where they are and making vaccination a convenient option, eliminating barriers and exploring how we can expand access to vaccination. And this could look like expanding your office hours for vaccination-only visits or drive-through vaccination, coupling COVID vaccination visits with routine vaccination, leveraging alternative vaccination sites like gyms, schools, community centers, and more. And lastly, collaborating with non-physician health professionals like pharmacists, EMTs, medical assistants, and more to support vaccination. Next, COVID has reiterated the absolute value of leveraging data and data systems. At the practice and health system level, vaccine registries or immunization information systems can be leveraged to understand the vaccination status within your practice and send reminders to recall patients back in. Health departments can do this as well through an approach called centralized reminder recall. With this, it is equally important then to document vaccinations when administered to ensure that the data within the IAS or immunization information system is up to date. And now next, I realize I'm preaching to the choir when saying this, but it's critically important that providers use every opportunity to educate patients and parents about vaccination. As providers, you are the #1 trusted source of information around vaccines and vaccination. And while patients may be coming in for other services like wellness visits, or in particular right now, COVID vaccination, this is a great opportunity to have a conversation with your patients about the other important vaccinations that may be recommended for your patient. We can also leverage digital media to drive awareness. This can look like sharing information via email, newsletters, social media from trusted messengers such as yourselves, detailing the importance of protection from vaccine preventable diseases. And lastly, it is critical to work with and elevate trusted voices within the community to promote vaccination and build confidence in vaccines and vaccination. This includes collaborating with community leaders, youth advocates, faith leaders, integrating community health workers in clinical settings, and more. Now, in addition to these short-term strategies, there are also important system strengthening strategies that can support building a more robust and resilient vaccine ecosystem. Now, what do I mean by a resilient and robust vaccine ecosystem? I've said this a few times today. Well, a resilient ecosystem is one that can withstand disruptions and help us achieve high vaccine coverage rates and help reduce incidence of disease and outbreaks. So when the next COVID crisis occurs, our health system is strong, it's prepared, and we don't see such intense disruptions to critical health services like routine vaccination. This starts with enhancing immunization information systems to support vaccination at the point of clinical care, as well as from the population health level. As I mentioned previously, quality and timely data is essential to being able to understand vaccination rates in your community, within your practice, identify where gaps are in the community, and monitor trends over time. Another key area is building vaccine confidence and trust in public health, as well as understanding and addressing the underlying reasons for vaccine hesitancy. We have seen how key this is in our COVID vaccination efforts. Additionally, we must make vaccination services easily accessible for patients by removing barriers to vaccination, such as no out-of-pocket costs for patients, ensuring you as providers are being adequately reimbursed, and providing convenient access to vaccination sites. And lastly, the pandemic has illustrated the importance of investment in public health. Numerous reports during the pandemic have highlighted that our public health system has been woefully under-resourced. In order to achieve and sustain high vaccination coverage rates and sustain the various strategies we've talked about today, as well as others, adequate and sustained investment in the vaccine infrastructure will be paramount. And so as I wrap up, I'll leave you with the following. While ending the pandemic right now through COVID vaccination is mission critical, we must not lose sight of the importance of routine vaccination. As trusted voices within your community, and particularly as family doctors, you play such a critically important role in supporting vaccination across the whole life course. And while the road to recovery may seem daunting in the face of many other challenges and some of the data that we've shared with you today, I want to underscore that there are things that can be done and that this is a team effort, right? We are in this together, and collaborating with others in your community can help us build back stronger together. So thank you all for your time and for the Annals of Family Medicine for providing us this opportunity. I also want to take a moment to extend my gratitude to my fellow co-authors, Eva Skolnick, Anna Larson, and Dr. Rachel Mitrovich for their collaboration on this work. With that, we are so happy to take any questions or comments through the question box or chat.
Great. Thank you both so much for the presentation. We do have some interesting questions coming in. One of the questions in the chat pointed out that with rising rates of vaccine hesitancy driven by concerns in the US, at least by the COVID vaccine, do you see this distrust leaking into general vaccine decisions? And maybe you can build on part of your presentation where you talked about practical steps that physicians, especially in family medicine, can take to build confidence.
Great, Bettina, I'm happy to answer that question on behalf of the group. I think as we've all seen, is vaccine hesitancy is definitely a threat to public health, as well as an issue that has really come to light more during COVID-19. A lot of it having to do with the spread of misinformation and disinformation. And I think this is something that we are starting to see trickle down into routine immunization and recommendations outside of just COVID-19 vaccination. And because vaccine hesitancy is really an issue that's highly context specific, and experience really indicates that different countries and different settings experience different shocks related to anti-vaccine activity, that we really need to improve overall trust, not only in public health, but as Alexandra mentioned, in also vaccination in general. And I think this really starts by really understanding the underlying reasons for hesitancy in your patient population or geographic region. And I think once you're able to really have that baseline understanding, it's then engaging healthcare workers and providers that are having that point of contact with patients to really assure them the value of vaccination, the safety of the product, and the recommendation in order to prevent future disease spread, as well as their individual health and health around those. And then once you have a general understanding, I think it's equally important that you really tailor your communication strategies to really promote acceptance and address that misinformation regarding vaccination. And I think those are really steps that we can take, because this is such a diverse and multi-complex issue, to really start to combat the negative impressions or commentary that's arisen in terms of COVID-19 vaccines, to ensure that they don't really have a strong trickle-down effect into routine immunization and other vaccines that are administered.
Maybe Rachel, building upon that, I'll just add and underscore that the message is very important, but so too, and perhaps even more, is the messenger. And so as Rachel mentioned, and we mentioned earlier, To address vaccine confidence is really going to have to start at the local level and leveraging trusted messengers. And this looks like providers as well as community leaders, youth-based advocates, and more. So I think the investment in supporting local trusted messengers is going to be key to actually building that trust and confidence in public health and vaccination.
Great, thank you. We had another question. Of course, your paper is focused on falling rates of vaccination across the US, but what does this trend look like around the world?
Thanks, Bettina. I can take this question. So routine vaccination has been severely impacted by the COVID-19 pandemic, and we've seen this not just in the United States, but on a global scale. The WHO in April came out with a survey that reported that over 1/3 of countries were still reporting continued disruptions to routine vaccination programs. And these disruptions have we found a statistic, nearly 228 million people, mostly children, at risk for infectious diseases. So for adolescent and adult programs, these early estimates also indicate a substantial decline, but the full extent of the pandemic's impact is not really clear, due in part to lack of comprehensive data systems for these populations and additional barriers to vaccine infrastructure. We will say that right now, countries are really focusing on both how to achieve high vaccine coverage rates for routine vaccination, and at the same time, identifying and vaccinating those who have missed vaccinations during the pandemic over the past year and a half. So I'll also add that this has been really debilitating for low and middle income countries, especially given their limited capacity to address COVID-19, in addition to other health challenges that coexist with COVID-19, including the threat of other vaccine preventable diseases. So, for example, we know that vaccine uptake estimates from 2020 show that up to 17 million children, mostly from underserved or vulnerable communities, didn't receive any vaccines. And this really exacerbates a conversation that we've been having around health inequities and vaccine access. This is something we're seeing really on a global scale. This is a big problem. And Rachel, I think maybe, do you have any additional things to add to that point?
Yeah, and I think you've really, with the statistics, highlighted the importance of improving routine immunization program capacity around the world, and why we really need to enable countries to adeptly prevent, manage, as well as recover from outbreak-prone vaccine preventable diseases, as well as vaccine preventable attributable long-term cancer and diseases, as we see associated with HPV and other diseases. And if we look at this on a global scale, I think it's really important to keep in mind that the actions that we take today will really determine the course of vaccination around the world in coming years. And as we start to think about the ambitious goals that are laid out, whether it's Sustainable Development Goals or WHO's Immunization Agenda 2030 or HPV elimination goals, that vaccination programs will require the resources, the capabilities, as well as the agility that we've had to employ over the past year and a half to really enable policy as well as programmatic changes to ensure that these programs really are sustainable and resilient over time.
Great, thank you. And in the 2 minutes that we have left, maybe you can talk a little bit about how you've seen maybe companies and other sectors outside of perhaps medicine itself working together to deliver vaccines and ensuring that we don't lose these the battle against falling rates of vaccination.
Yeah, I can take that one. I think what has been exciting to see is that stakeholders have really mobilized, right? And so we've been presenting this data, the CDC has taken action, has issued multiple calls to action. Cancer societies have issued multiple calls to action to really recover routine vaccination rates. And we've seen many different sectors come together. And so I can highlight a few different examples. First, the business community, right? So the business community has come together by offering routine vaccinations at work to try and recover routine vaccination rates. Hospitals and healthcare systems have been deploying mobile clinic vans. What you've heard today is really the importance of meeting people where they are. And when hospitals and healthcare systems were feeling like they couldn't bring patients in safely, they decided to go out, meet patients where they were, and deploy these mobile clinic vans to really try and increase routine vaccination rates. We saw Medicaid, so governmental agencies, changing guidance for telehealth and routine vaccination, making sure that routine vaccination was a priority when receiving telehealth services. And then lastly, a lot of great public-private partnerships, such as large companies partnering with local community-based organizations as trusted messengers to really make sure that people understand the value of vaccination. And so what we've seen is that everyone is playing their part for an all hands on deck approach to ensure that we recover routine vaccination rates.
Great. And on that note, what a perfect way to end the presentation. So thank you for everyone for joining us today for our first mini grand rounds. And special thanks to our authors and presenters, and of course to all our attendees. And we look forward to seeing you for the next event.